as we move through this conversation, and for our next speaker, Nat Kendall Taylor, I'm just going to open a question to you all. How many times have you met an academic anthropologist, right, who says that, just with no sense of irony, I just want to help make real change happen, right? Well, today we are 1 for 1 on that one. Nat Kendall Taylor is an anthropologist, and he is also the chief executive officer of the Frameworks Institute. So Nat oversees the organization's pioneering research-based approach to strategic communications. There he is. And they use methods from social and behavioral science to measure how people understand complex issues and then test the ways to reframe them, right, to drive social change. Right. He's also the senior fellow at the Center on the Developing Child at Harvard University, a visiting professor at the Child Studies Center at Yale School of Medicine. And he's a guy who told me straight out, I know some things and I can do some things. And he's pretty confident that those things can help us change how people interact with diabetes and the stigma that surrounds it. So now let me introduce you all to Nat Kendall Taylor. Nat, take it away.
Thank you very much. And I'm going to share my screen here. Just give me 1 second. And I should be good. Well, thank you very much. And it's important to know that after I said that to David, I said, but there's a whole lot more that I don't know, just so you have some sense of my hopefully humble presentation of what is to come. I just want to say that I'm super glad that that video worked, because if it didn't, I was going to be a dismal and very disappointing consolation prize to Anthony Anderson. So this is going great. I'm so glad that worked, and I'm so glad that I get to be here with you all to do my absolute favorite thing in the world, which is to talk about framing. And I realize that's utterly sad and pathetic, but it does mean that for the next 15 minutes, there's going to be one person on this call who's having a good time. That will be me. I will have fun. I wanted just to thank the Diatribe Foundation for inviting me, and no offense, but the most important thank you is to all of you who are on the line right now, spending your time with us. And I realize that time is very valuable, and in exchange for that time, I'm gonna do my absolute best to use the next 15 minutes to be as utterly helpful as possible, talking about something that is pretty far outside the medical field and certainly the diabetes field. So that's really important that you know that I'm neither of those two things. So I'm not an expert in diabetes, and I am a doctor, but I'm not the kind of doctor that stands up when someone asks if they're a doctor on the plane. I'm a psychological anthropologist by training. And what I do and have done for the last 20 years is study how culture influences the way that people think, how people use culture to process information, to make meaning of messages, and to formulate and reach decisions. And so I'm super glad to be here with you today. And one of my goals is that at least one of you is at least half as excited about culture and framing after I'm finished here. I think I can do it. I'm a fan of nice low bars. So let's get to it. At the beginning, so I'm going to be talking about framing for the next 15 minutes. I think it's important that we establish a kind of common definition of what that term means. It's one of these words like narrative change that has become so ubiquitous that I fear it has lost any and all meaning it ever once had. So what we mean on this call, what I mean for the next 14 minutes is by framing is the choices that we all make and how we present information. And sometimes those are really small choices and seem rather insignificant. The pronouns that we use, whether we talk about us and them, or whether we talk about we and ours, the verbs that we choose and how those verbs either imply or deny agency to various groups of people, as well as the really kind of more obvious and in-your-face choices that we make as communicators, the values that we endorse to argue for why addressing an issue is so important, the metaphors we choose to explain how something works. Framing is about how all of those choices, big and small, that we make as communicators, and I'm going to argue that each and every one of us on this webinar right now is a communicator. Framing is about how those choices influence how people think, how they feel, and what they are or are not willing to do as a result of hearing what we have to say. I'm going to give you an example of what this looks like. As I said, I'm not an expert in the field of diabetes, nor am I an expert in framing diabetes, but I have worked on a number of issues that have kind of as their crux or as their turning challenge, this issue of stereotype and stigma. So I've picked an example that comes from some work that my organization, the Frameworks Institute, has done on framing child mental health. And so we work with an organization who has as their mission to take the science of early childhood development and translate it for people who are in policy and practice making positions. And these scientists struggle mightily to communicate the particular concept within the larger field of early childhood of child mental health. So most Americans don't believe that very young children can even have states of mental health. And they're also not wildly supportive of using more public funds to support the mental health of young children. So that was really our challenge in this piece of work, to figure out ways of framing, of communicating the issue of child mental health that increased people's sense of the importance of the issue, what we call in communications salience, so kind of its top of mindness, where it sits in the issue agenda amongst other social issues. And then really pragmatically to increase support for the kinds of policies and programs that intervention science has shown are effective in improving healthy child development and supporting child mental health. So you're going to see one particular piece of that larger research project. It's a survey. It's an experimental survey that was conducted with just over 6,000 people. And how this experiment works is that each of those 6,000 people is randomly assigned to read a message on the screen. And the message is basically a description of a child mental health program, except it's framed at the top with a value. So a third of the people who are on this experiment get randomly assigned to a value of future progress and social prosperity. So they would read an opening to this description that sounds something like, we need to do a better job of addressing child mental health because, and we wouldn't say it in such a hackneyed and cliched way, because children are our future, right? They're stable, they're solid. Mental health is really important to our ability to progress as a country, to move forward and be successful. Another third randomly assigned of the larger sample gets assigned to hear the value of vulnerability. So they read the same 80 words, right? It's the same description of the program, except the lead-in, the first 10 to 15 words at the top is different. So instead of social progress and prosperity, these folks would read something like, it's important that we do a better job to support children's mental health because children are our most vulnerable citizens. They deserve our empathy and our compassion, and we must feel for them and do better by them. And then, yes, I can do math. That leaves 1/3 of the sample, which gets assigned to the control condition. So the control condition, in this case, is people who see no message, right? They read no message. They are this thin zero line that you see across the middle of the screen. And then everyone, regardless of what frame, what message they were exposed to, answers the same set of questions, which are designed to measure how supportive they are of this set of evidence-based policies. So what you're going to see on the next screen are what I think are two absolutely gorgeous green bars are going to appear. And those green bars are going to show you the extent to which hearing those two different frames, right, the different ways that the issue are framed, affects people's support for those policies. And I don't know the kind of statistical acumen of this audience, so I'll give you a quick stats lesson in regression analysis. Up is good, and down is not good. So you see on the left-hand side of the screen that value of collective progress and prosperity is having a strong and statistically significant positive effect on people's support for those policies. That's good news. When we get those kind of results, there's a little framing dance that we do. Don't worry, David, I will not do it now for anyone here on the webinar, but your eyes probably also wandered towards the right-hand side of the screen where you see news that is decidedly less positive. So that value of vulnerability is not only 0, which remember is no message, but it is actually depressing people's support for these policies that the field is advocating for. So let me translate that for you. If you're an expert or an advocate working on issues of child mental health in the United States and you use value of vulnerability to frame your messages, you not only waste your breath, you not only waste your valuable communications resources, but you use those very resources in a way that directly disadvantages your goals as experts, as advocates, as researchers. And just to be clear, when it comes to communications, that is not what you want to be doing. That is not good news. The really interesting thing is that after this experiment, we conducted a systematic analysis of all of the field's external-facing communications over a 3-year period. So this is all the websites, the press releases, blogs, the mission statements, the pamphlets. And guess which value we found to be used in over 90% of those communications. And because of this format, that has to be a rhetorical question, unfortunately. That is the value of vulnerability, right? So what we found, in essence, that for a long time, with a shocking amount of resource, the field had essentially been using a value that, again, not only wasted those resources, but used those resources in a way that directly disadvantaged their goals as advocates. So I've come to think about framing through a metaphor, and it's the idea that these frames that we use and choose, these choices that we make as communicators, are not just kind of purple prose that sound good and adorn our information, but rather they are these vital keys that we have that can unlock thinking, that can create space for people to engage with our issues in new ways, that can advance and provide a channel for people to come to support the kind of solutions that we know are vital and important to addressing a problem. That's the kind of optimistic entailment of the key metaphor. The negative entailment, the negative meaning, is that those frames can also do the opposite, right? The choices that we make inadvertently, in the case of vulnerability, lock down thinking, freeze up understanding, have people reject our messages, or worse, have them take the exact opposite message that we intend from our communications away from that engagement. And we know that framing has always mattered. So I've been doing framing for a very long time. It has mattered for each and every year, for each and every month, for each and every minute that I have done it. But it is really important and has really mattered in some obvious ways over the last 7 months. And I have collected over the last 7 months examples of framing that there's really solid research shows has some unintended, or some cases intended, but negative effects. And so I wanted to just take you through a number of these. And I think that both the child mental health and the vulnerability example is well chosen, I hope, for the work that you all do. And I hope that these examples also illustrate and provide some commentary on some of the main framing challenges and framing effects that exist around the issue of diabetes. So the first and the most obvious is the one that emerged early on in the pandemic, where the pandemic was labeled the Chinese virus. And this is a very well-studied and accepted finding, is that what this framing does, and I would argue deliberately, is it creates a palpable fear of others. It creates a kind of insular nationalism, and most interestingly and important, it elicits a sense of racism or a racist response that we have found not only attaches to the group at which this frame is directed, but in some really ugly ways kind of wiggles and wanders and attaches to all different kinds of groups of people around which there are well-held societal and cultural stereotypes. The second one of my personal favorites, is the way in which public health measures have been labeled as draconian in their approach. And what this does really strongly and immediately is create the sense that these measures are an obvious overreaction, and elicits a sense in which we are resistant to information and hesitant to act on what is vital public health advice. Another one, which relates to the child mental health one, is all the ways in which certain groups of people are being labeled repeatedly and explicitly as vulnerable. I think this is most pernicious when it comes to how older people are being labeled. And we know in the last 7 months, but there's a long and rich history of scholarship that looks at vulnerability framing and finds that what it does is it instantly others, right? It instantly creates an us and them perspective. It creates really strong zero-sum thinking in which any more for they and them over there means less for me and mine over here. And it perpetuates stigma. Stigma not only in terms of how we think about certain groups of people, but as Rebecca talked about, how individuals within that group think about themselves. Imagine being in a group and being told continually, repeatedly over time, that your group, as a group, is being essentialized as vulnerable, and what kind of effects that would have on your identity and all kind of behaviors and health impacts that ensue. Another one that we've been seeing a lot is people of color being infected or dying at higher rates. And there's really good research that shows that what this does is that it unfortunately does not send people's attention going to the structures and the systems that explain this phenomenon, but actually sends people back to blaming individuals and their choices and their health behaviors and their quote unquote values in creating these disparities. And last but not least, related to, but kind of the second issue that we've been up against over the last not quite 7 months is this call to confront racism, and how we have seen that there's some framing effects that go on here, right? And what this does is that, again, it doesn't send people focusing on the systemic and structural features of racism, and instead it leads people to blame the kind of bad apples that have hateful or backward ways of thinking, and to try to root them out of systems rather than to change the systems in which they are operating and embedded. And so I want to end with a quote. This is one of my favorite new quotes about framing. It's from a guy named Charles Eisenstein, who is I think he calls himself a philosopher. He is a purveyor of awesome quotes. And this is really a powerful way to think about framing and what it can do for a social issue like the one that you work on. And so Charles Eisenstein said, "The world as we know it is built on a story. And to be a change agent is first to disrupt the existing story of the world, and second, to tell a new story of the world so that people have a place to go." And with that, I'd like to say thank you. I'd like to encourage you all to go out and frame on.
Thank you, Nat. Wow. I mean, so I am officially now super excited by framing. So you have succeeded. As a side note, I might still hold you to that framing dance. We might need to see that in the Q&A. So just heads up, get ready, work on your camera angle. But I think this whole notion of framing, you know, obviously from where I come from in terms of method acting, everything is a communication, right? But it's one thing to know everything is a communication, but to see the power of that communication, right, is really impactful, right? And this last notion of disrupting the story is incredibly powerful. So I think one of the things I would add to Eisenstein's quote is for us to recognize, as we're going to disrupt the story, know that we're part of it, that we're actually part of telling this story, right? The way that we communicate, the way we frame, the way we live, frankly, the way I have lived my life as a person with diabetes contributes in at least some way to the framing and therefore to the story, right? So there's responsibility on us and opportunity, both together. Those two things always come in the bundle together. But thank you for adding that to our conversation today.